let's say you have a patient that can't come they have a decayed area and they can't be seen for several months. And obviously we know, especially based on their diet or their saliva, things like that, that cavity is just going to get bigger in the next couple months. And then we're going to have to place a bigger restoration. So you could potentially place silver fluoride that day, stop that decay from getting any bigger. Then they're going to come back in a couple months and your filling is not as big. And this is such a great part of non-invasive dentistry, because if we're putting a filling on a brand new first molar, right? It's erupted when they're 6. No matter what size of it, that filling's only going to last a handful of years. Then they're going to have another one. Then they're going to have a crown and root canal. Like the lifestyle of a tooth. And we are living so much longer now. We're keeping our teeth so much longer now. If we can avoid fillings as long as possible, just for that lifestyle cycle of the tooth, that would be amazing. So that's why a lot of times this is applied on kids, because if we can avoid fillings, that would be awesome. But anyone, we're going to keep our teeth for 100 years now. So if we can prevent restorations as long as possible, that is key. So obviously we can apply it for sensitivity. That's the on label. We can apply it under to stop decay. We can apply it to just like fortify areas. If you have a patient, again, that can't come to your traditional brick and mortar, maybe homebound, haven't seen dental care for a while, they do have areas of decay. We can stop that decay from getting any bigger. We could prevent a toothache. How awesome would that be? And just support our patients in a different way that maybe we haven't been in the past.
Wow, Malia, you hit on something really special and you hit on the quality of care for our patients. And while you were talking about, our patients wanting to eat colder food during the summer, and all I could think of, like, while you were speaking was like, wow, Malia is such an awesome hygienist. Like, she is really in this for the patients. Like, just listening to you, I could like really just hear and feel your passion about being a provider. So thank you first. But then also, um, the other thing you hit on that was really cool that I really is starting to match a lot of mainstream clinicians, where we do want to shift to a more non-invasive dental style. And Clear Defense matches that really, really well. So, for me, I see that as a trend shift in our industry. In your opinion, are you also seeing a trend shift as well?
Yeah. So I do want to say one thing, that a lot of the research with like silver fluorides, they don't include children in the studies, just because, it's when you do research on it with a child, it's tricky, it's a lot harder, things like that. So a lot of the research when you look up nano silver is on adults. I just want to say that.